Welcome everyone. We'll get started in just a moment. We'll just give it one more minute for people to come into the room. Okay, I think we're going to reach a critical mass of 40 and then that's it. We'll kick off. we're expecting possibly about 80 of you today, so we might have other people join us as we go. So I'm sat in semi-darkness here. Okay, I think as the pings have sort of slowed, we'll make a start. So welcome everyone. Thank you so much for making the time to be here today. My name is Katie. I am Director of Research at IVAR, the Institute for Voluntary Action Research, and it's been my pleasure to have been involved in the Community Participatory Action Research Programme over the last year. My colleague Sonakshi is going to talk a bit more about that in a moment, but we're so pleased that you could be with us here today. As you probably know, the idea of this webinar is to act as a precursor to some local workshops that will be happening in your areas, at least in two cases. In some cases, some of you have actually started to have the conversations with your local community researchers, which is fantastic. During those sessions, you will have the opportunity to hear from community researchers about their research and recommendations that have come through from that, and have some discussions together about the next steps and actions to take forward following their research. The reason we wanted to run this webinar in advance of a lot of those workshops, and regardless of whether you're taking part in one of them or not, we recognised that there was perhaps a need to do a bit of demystification around partnership working, and specifically the topic of kind of how local decision makers and communities work together effectively. We recognise that navigating partnership working and understanding how local decision makers and communities can work together effectively can be really challenging. It's not easy work. We're also in a particularly interesting policy context where NHS England recognises that voluntary community and social enterprise organisations play a really essential role in local health and care systems. And there are also clear expectations that VCSE organisations should be involved in both ICS governance structures and in delivery. However, what we know, and from our own experiences and as acknowledged in NHS guidance, there are significant challenges with this. Partnership and collaboration, to state the obvious, is not easy work in whatever context you're working. And when you look at that in the context of ICS areas, in some cases, there can be as many as 16,000 voluntary sector organisations just in your region. So when we think about that in relation to partnership and collaboration, you know, that gives us an idea of the scale and complexity. At the same time, what we know and feel very passionate about as IVAR is that the diversity of this sector is a real strength to be recognised and celebrated. But it, of course, at the same time can be daunting to then work out how you engage with that sector in a very systematic way. Equally, on the other side, for voluntary sector organisations, it can be an incredibly complex landscape to try and navigate. You know, even for those of us within the structures, even for those of you that work within NHS systems, they can be baffling and mind-boggling. So imagine being sat outside of that structure and sort of trying to understand them. And that is at the same time as, for many of those organisations, trying to overcome certain funding and time constraints as well. Hence, the focus of this webinar is on how can we do that better, given the context, given all of the constraints that surround us. What are the opportunities to collaborate and work in partnership? Before I sort of pass on to Sonakshi to tell you a bit about the specifics of our involvement in the programme, I just want to tell those of you that perhaps are less familiar with it a little bit about the Community Participatory Action Research Programme. So it's a programme that was initiated by and is led by the NHS Workforce Training and Education South East. It's a training and mentoring program, and it supports voluntary sector organisations and communities to undertake research in their communities on their experiences of health inequalities and how these can be overcome. We're really pleased today. We've got both Em and Joanne in the room who are from NHS Workforce Training and Education. So if you have any specific questions about the programme, either during the session or afterwards, please do reach out to them. During 2023 and 24, the focus of the CPAR programme has been on the impact of the rising cost of living. And the risk that this poses to many being unable to afford the essentials and therefore being able to maintain their health and well-being at the same time as causing increased stress and anxiety. So we know that there is a direct link between cost of living and health and well-being. And that's what the 30 community researchers that have been involved in this programme have been looking at within their geographical areas. And those are, we've got stakeholders here with us today from all of the 4 regions, so Buckinghamshire, Oxfordshire and Berkshire, Hampshire and the Isle of Wight, Kent and Medway, and Sussex Healthcare Partnership. Have all been involved in this phase of the programme. And I think hopefully I see a couple of familiar names and faces, and I think some of you were actually at the CPAR showcase. Others of you may be sort of coming to this work for the first time, and that's fine. So in terms of the flow of the webinar, we'll be with you for the next hour up until 2. The structure is, in a minute, I'm going to pass on to Sonakshi to share a few of the key things that we've learnt about collaboration through our wider work as IVAR. We're really fortunate to have with us here today researchers from both Buckinghamshire, Oxfordshire and Berkshire, as well as Sussex, to share with you some specific insights from their research pieces and give you a kind of flavour of the process that they've gone through to get to this point. So I think that's probably enough from me. Hopefully that gives you a sense of what's to come. Thank you again for everyone for making the time to be here today. I see we've now got 46 people joining us, which is fantastic. Sonakshi, I'm going to hand over to you.
Thanks, Katie. I'm just bringing up my slides. Let me know when you can see that. So I'm Sonakshi. I'm a senior researcher at IVAR, which is Institute for Voluntary Action Research. A bit about IVAR. We facilitate collaboration and learning with charities, foundations, and public agencies to deliver useful and usable insights that make a difference to communities. And we kind of operate at an interface of the 3 sectors, and everything we do is about partnerships and supporting communities to do the best and serve the causes that they serve. So at IVAR, we've been supporting local partnerships between voluntary as well as public sectors, supporting collaborations and partnership working for around 18 years now. Through the CPAR work, we've been working alongside the NHS Workforce Training and Education Southeast program as a training partner to support community researchers in identifying how their research can inform both and influence the priorities, policies, and development of health services for marginalized communities in the Southeast. So we've been, as Katie said, we've been doing this kind of work for a long time now, and we have produced a report which is called Not Just Ticking Boxes. And I wanted to just share a few key messages that really highlight the role of the voluntary sector and communities and why cross-sector partnerships are important. It's not anything new. You might have already heard this, but just wanted to reiterate that as we start listening to what the community researchers have to say as well. So firstly, voluntary sector organizations and communities need to be involved in decision making about services that affect local people, as they hold important intelligence and data about the local need. Working in this way ensures that the solution to local challenges are more streamlined and the risk of duplication or saturation of work towards a particular group is avoided. Secondly, for good partnership working, statutory partners need to recognize the role that the voluntary sector plays in providing healthcare, well-being, and reducing health inequalities, and see them as equal partners. And finally, that the voluntary sector partners and community leaders can provide the much needed flexibility in delivering services at times when NHS organizations can focus only on delivering essential work. And there's a very interesting quote in the report that talks about the voluntary sector. Value the VCS. Don't consider them as cheap or the ones who keep needing funding all the time. See them as valued partners. This segues really nicely into some key messages for demystifying partnership working that I wanted to share with you today. My slides, next one. There we go. Yeah. So there are 6 key messages that I wanted to highlight as we start thinking of demystifying partnership working. Firstly, be clear about your purpose and why you want to work in a partnership, in a cross-sector partnership. So start by asking the question, why are you bringing people together? What do you want to hope to achieve? From our experience, it can be really hard to narrow that down and come up with a combined vision. But we from our experience, we think it's a really important step to start there. Which brings us to the second point, which is start somewhere. So go where the energy is. Choose a geography or a community who have a vision for change. Harness their energy and excitement to establish relationships and a new way of working. Thirdly, be ready to test and learn. Now, working in partnerships, as we all know, can feel a bit messy. So, create time and permission to step back from the day to day and review how things are going, reflect together, and adapt your approach. Fourthly, ask if the right people are involved in the work. Now, meaningful buy-in from our experience from senior leaders can make a real difference. And meaningful representation from a range of different partners around the decision-making table really enhances partnership working. And regularly asking, who are we working with? Who is not in the room? Who needs to be here? Can really help in the long run. Fifthly, have a dual focus on action and relationships. Now, the doing things together and the action side is really important, but don't forget to cultivate relationship and maintain the relationships that kind of underpin the joint action. Collaborative working can be emotionally hard, and it's important to recognize this and to create opportunities for people to express their frustrations, reconnect with the ambitions and the purpose of what work you're doing together. And linked to this is also celebrating wins along the way, however small they might be. And finally, explore with communities what helps to sustain collaboration in the long run. From our experience, identifying individuals or system leaders who can act as collaborative champions is really helpful. And by collaborative champions, I mean people who have the ability to look beyond their organizations and spot those opportunities for collaboration and a greater relationship building and bringing people together. One thing that helps sustain partnership working is ensuring people have time not just to reflect on the work that they're doing together, but also how are they working together. So reflecting on what's working, what's not working, and adapting accordingly. And our community researchers are very much these collaborative champions who can help be the bridge between services as well as the community. And finally, I would like to share that we as IVA are an independent research institution, but we are not completely neutral. We believe in the power of the voluntary sector and involving communities in addressing the challenges that affect them. And that's the starting point for this work. The two things I would like to end on today are firstly, work with local communities because this leads to better service design and delivery. We often see the temptation to kind of simplify engagement with communities and the voluntary sector, and this risks missing out on the nuance of why certain issues prevail and on developing effective solutions. We know that communities are well placed to determine if a solution is viable or usable. Involving them in action planning really means valuing people and their stories and their lived experience and recognizing that they can make the right choice for their health and well-being. However, they need to be involved in the design of services and given choices based on their need. Secondly, challenge and change the language you're using. Many communities And groups don't like to be labeled as deprived or BAME or socially isolated. And there might be stigma attached to certain health conditions, like, for example, tuberculosis. So, using language that really strengthens individuals and is asset based is really important. And you can achieve this through constructive dialogue and conversations with communities and groups involved in this work. And both of these places are the places where the community researchers definitely have a role in supporting you to do that. I will end there and I will hand back to Katie, and you will hear from the amazing community researchers. But do ask us any questions at the end. I'm handing back to you, Katie, now.
Oh, sorry. Thank you very much. Right, without further ado, because these are really the most important people that you need to hear from today. I would like to introduce, so you're gonna first off hear from Alison, and then Mujahid and Hassan. But I'm going to ask Alison to speak first. So we have Alison Bond with us from the Home Start programme in Portsmouth. Apologies, I said Sussex earlier. I should have said Kent and Medway. So Alison's project title is the current cost of living making a difference to the health and happiness of Portsmouth families? So Alison, I'm going to ask you to join us. I can't see you on the screen actually. And actually we got Alison with us.
I'm here.
Oh, sorry, you're just not on my screen. I don't know why. I couldn't see you.
Hello.
Fantastic. All right, Alison, I will hand over to you.
Okay, thank you so much. So yeah, so I came aboard the CPAR project because of my links with Home Start Portsmouth. So I started to volunteer with the parent boards in 2019, and then that led me to learning more about Home Start, and I did their stay and play training during lockdown. And then when we came out of lockdown, I've been helping to run groups which are basically free, and they're for parents with children from 0 to 5 years old. And it's, kind of, it's not just somewhere where the children can play and do lots of things which help with their development. It's also where parents can have a chat with each other and also with us. Kind of like as volunteers, we try to learn as much about what's out there in terms of services and also support, so we can signpost. So like if a parent's got a certain kind of question, we can try to answer or find out where they could get those answers. So through that time, a lot of kind of the chat had been about the cost of living and added worry, like on the stress of it, how they really valued having somewhere they could come, which didn't cost them money, which then that led to my choice of topic. So basically, like I spoke to quite a few parents and asked like, is the current cost of living affecting the health and happiness of you and or your family? And of course, kind of most came back and said yes, it is. And it kind of like, it wasn't just about sort of their health, it was also where they were worried about maybe their partner or husband who was feeling the pressure of trying to kind of get more like hours at work and things like this. It was just kind of little things like sort of going kind of out for like a beach walk and having to say no, like if a child was saying, oh, can I have like a nice cream or like a donut or something. So it's really about suddenly these things kind of that had been a normal part of life were becoming harder. And other findings were where sort of there was a real sense of, you know, feeling resigned, kind of this is just now what and how life is, which I found quite sad. You know, and sort of they were trying to protect their children from, you know, sort of knowing if things were getting quite tough, you know, the fact that they couldn't access healthcare and also dental care, you know, because, you know, they just couldn't get an appointment. Like in, yeah, kind of Portsmouth, there's no actual dental care that is now NHS, yeah, kind of funded. So, I mean, that's awful. And also, a big thing was just kind of they weren't sure where to go for info, you know, so that they wanted to be able to have a more cohesive way, like of knowing what's out there. So from that, I wanted to act on those findings. So like I started something that kind of that was very kind of easy, which was a page on Facebook to share as much knowledge as I have in terms of kind of a support and services. Like I reach out to various kinds of groups and say, can I sort of have your timetables, etc. I'm also building a website where I can take that even further. I was then invited to work with the newly founded HDRC, which is the health. Okay, sorry, like I've got a stutter, and so saying these long words is a real pain, like in the bum, basically. It's a health determinants research. Sorry, a collaboration. There we go, and it's between Portsmouth Uni and PCC and the Hive, which is like a charity. And so they wanted the community research aspect to help develop their kind of current projects and also projects down the line. So that's been great. I'm also working on a research project looking at the first 1,001 days in a parent's life with a child's, so that's kind of from a kind of conception to age about 2-ish, and so that's again getting a lot of feedback so we can help kind of really get the support and services, you know, very sort of family centered and working well. In relation to, you know, kind of not wanting children to know about, you know, sort of what the situation is. When I was at the showcase, I met somebody from the Money and Pension Service, and we are working on what's called Talk, Learn, Talk, Learn, Do, which is where parents can learn how to chat more with their children, you know, not just about budget, but kind of about sort of not using, you know, kind of pester power. So please, mummy, 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 can I? Which we've all been through, I think, at one stage, or like have done it ourselves, guilty. So it's not just kind of telling somebody how to spend, like, or not spend. It's very much working with. And I've had my research shared with the PPC Public Health team. It's also getting used, working with some social workers, and also I've just been asked if it can be shared relating, I think, to working with people linked to some sort of energy kind of, you know, sort of trying to get bills down, etc. Sorry, like I'm just kind of trying to rush through. I'm also working with Healthwatch Portsmouth, so we're kind of going to work in partnership where they can tap into my connections and come and chat with parents and get direct feedback, but they're also going to share my work with, you know, people quite up like in sort of the health kind of departments in Hampshire. So yeah, that's what I've been doing directly from the CPAR. In terms of how I found working with stakeholders, it's about really both kind of parties wanting to connect, to make a change, to think about working with, not doing two, not doing four. So having, you know, kind of like a receptive attitude and really valuing each other. You know, it can be hard because, you know, like as a researcher, you know, kind of depending sort of when your funding ends and if you've got other work, etc., then just might not be the time and space to do it like in the way I have. And also for the stakeholders, they've got their budgets and they've got their remit. So, you know, kind of we can't just demand of each other, but we can definitely work kind of together. And that's me. Thank you for listening.
Alison, thank you so much. That was such a kind of lovely I know that it's hard when you've got sort of so much depth to a piece of research to try and summarize it, but you did it beautifully. Thank you. And I think that that end message really, I hope will resonate with those of us here around that importance of, you know, it's about connecting around something that you want to work on together. I think initially sort of setting aside some of the constraints that might sort of prevent that, you know, the bureaucracy, the budgets, etc., and just acknowledging actually we both have shared expertise around this topic, and let's go from that point. Yeah, thank you very much. And I think there's some stakeholders in the room that are already kind of working in partnership with Alison and others. So we may not get a chance to talk about it today, but I'd really encourage you know, people to reach out to Alison and stakeholders in Portsmouth that are already doing this kind of collaborative work as a way of kind of helping you think about how you can approach that too. Right, I am now going to pass on to Mujahid and Hassan from Oxford Community Action. And the title of their research is called I Really Feel the Kindness of Strangers, Community Views on Food and the Cost of Living. Hassan and Mujahid, over to you.
Thank you, Katie. So our research was such a profound, we had some really profound insights into our research, and it started off because we had started our food redistribution service at the start of the pandemic, and it still continues to this day. Every week we're now serving around 300 families still, and we've seen how people have come and gone, and what types of people, you know, sometimes even working class people or working poor people, if you want to call it that, are still accessing services like ours, which is still quite a shame. And when we looked through our research, and we were quite how do you say, like, dismayed by the kind of things. Sorry, you can't see me? Is that right?
I'm afraid not. No, we've just got a white box at the moment. Just in case,
Oh,
don't
really?
worry. But if there's an easy fix, then
maybe you
All
can
right,
just turn on and off your camera once. That might help.
Let me try a different camera. Does that work? No?
No, don't worry.
No.
Sorry, I didn't want to interrupt your
Okay.
flow, and I have. Carry on.
Okay. All right. Sorry about that, guys. All right. Yeah. So we were like looking at some of the comments that the people have made, and I'd like to just read out a couple of the comments that people just to stress the kind of difficulties that people are facing in this day and age. So one of them is rent is too expensive and making life uneasy. Landlords are also keep increasing rent. And regarding the food, it keeps me going with the money I have. I'd be literally stuck without it as I'd run out of food. And we would starve on several days a week. We truly struggle without them. But this last quote I'm going to read out is actually quite a phenomenal one. It's really uplifting actually. This person said, "It makes me feel that I matter to other people in the community." So there was like all these amazing different insights that we got into this thing. But from discussing with the people afterwards and also looking at all of our results, we found that there were three main things that we should be working towards, that the community really wanted us to action. So one of them was actually to create what we now call a social supermarket. And that came about from the problem that within our food redistribution service, people found that there wasn't that much of a large range of products available. And on top of that, the ingredients that they might be familiar with were not really there. And as we know, it's very expensive in order to get certain kinds of ingredients or foods, particular foods that people are used to in Oxford. So often a lot of families have to travel outside of the city if they have the means in order to get it for a reasonable price. So in order to solve this issue, we linked up with Good Food Oxfordshire. They're very good with knowing like who's who when it comes to food and distribution and so on. We talked to them to see whether we can pilot something like a social supermarket in Oxford. And then we came across another organization called Feeding Britain. And they have various models of social supermarkets up and down the country. So we thought, let's tap into that resource and figure out something from their suggestions. So they shared a lot of their learning and how they managed to develop this model. And now what we're trying to do is to work out how to develop our model in Oxford and to make it appropriate for all of our beneficiaries. So that was the first initiative that the community wanted us to work on. The second one is that a lot of people expressed the desire to grow their own food and to not be so dependent on handouts. So they already have the expertise of how to grow their own food, but they didn't have access to their own garden or any piece of land or even equipment. So they had the expertise, but they couldn't use that expertise. They couldn't put that expertise to good use. So we then talked to local organizations that support the development of community gardens. And now, luckily, we've been able to identify an allotment that we can take use of. And we're going to partner with someone employed by CAG Oxfordshire, that's Community Action Groups Oxfordshire. And they will look over, they'll help to oversee the gardening communities with one of their employees. So and this is an idea that because such a lot of people expressed the desire to do something like this, we thought, okay, let's develop our proof of concept. And we actually developed that in Hassan's back garden. Where we grew a lot of things there in the meantime, just to see if it would work and how it would work, and people are willing to go somewhere, in their locality. And we managed to grow quite a lot of things actually, a lot of lettuces, different types of lettuces, tomatoes, beans, and even onions. So that was a great. It's another initiative which is now starting to materialize. We've still got like a few other things to sort out, but this is still already a work in progress. And the third thing that the communities wanted us to do was that they expressed that there was a lot of there's a lot of issues that are unfortunately left unresolved because they don't have the means, they don't have the connections, they don't have the means to approach people who are in the know when it comes to official advice around things like housing or employment or debts or paying bills and that sort of thing. So what we did in order to resolve this, we made contact with the local advice centre. They call the Agnes Smith Advice Centre. And we told them about the feedback from the studies. And from there, they actually helped us to develop a pilot project where they can provide an outreach assistant, like a satellite service, basically based at our food redistribution service every week. And what that means is, sorry, am I still? I think something happened with my laptop. Can you guys still hear me?
Yeah, we can hear you fine.
You can. Oh, brilliant. Okay. So when we linked up with the Agnes Smith Advice Center, they've now we just said that they're now recruiting for that position. So hopefully this plan will be fully in action very, very soon. But the idea is that we bring the services and advice to the people who need it, which is within our food redistribution service that we have every Wednesday. And that's really the whole crux of this discussion. It's actually making figuring out what the communities want through the research, and then working with local organizations to bring those services to the community, and more importantly, not doing that the other way around. Right? So we didn't ask the communities to go to already existing services, which may or may not be appropriate for their cultures and for their backgrounds. But instead, what we did, we helped to design bespoke services for the community. And that, I feel, is only possible because of all the conversations that we've had, all the groundwork that members of OCA have done over the years with the community to build that trust amongst the community, so that our community members can easily open up to us with the issues, and so that they basically allow us to help resolve these issues. Yeah, so that's really the important parts of this this presentation. And I don't know if Hassan has anything else to add at this moment in time, but yeah, those were our three initiatives.
Yeah, I think you all said it, and I think the more important that we have to say today is the community are tired about researching. That what they want is like when you research something, they want to see the action being implemented, and action takes such a long time to institutions, organization, bigger anchor organization. But whereas in a small community, tiny community that has the trust within the community, saying, we listen to you, we understand you, this is your 3 action plans, and this is what we love to show you about it, that we not just taking a paper, and a questionnaire, but we're here to start understanding, and then we do together. And that's what is the difference of academic researchers and the community researchers. The community researchers are ordinated by action ordinated, and that's what is the beauty to sell it to community. Then they might listen more when you come to them and ask them questions. And that's what I only just started. The rest that already Mujahid said, and where those 3 actions already were on the way. And thanks, we're part of CPAR. If we wasn't that research last year, we would not listen to what community needed, because we're doing 4 years for food bank, and we did not understand why people are coming to us every single Wednesday, and it's not properly like a bag of food given every day for somebody. That's not help their health, does not help sorting their problems. And then now on, we know it, like if we bring somebody more information, they might less benefit, they don't mind climate, they don't know, they can get more money to survive themselves. Then we're really happy about it so far, what so far the community and us did together.
Amazing. Mujahid, Hassan, thank you so much. I think two really key things that you ended on there. The importance of the role of organisations like Oxford Community Action and others in terms of the trust and relationships that you have with communities, and what that means in terms of the solutions that you're able to, a genuine process of being able to co-design services, and the role that voluntary sector organisations can play in that. And Hassan, your point around, research has to be combined with action. Otherwise, communities are already feeling over-researched if there isn't action attached. So linking on from that, the last sort of 10-15 minutes or so is really for your questions, those of you in the room. and or reflections. So please do, if you've got a question, do raise your hand or put up the hand emoji, or pop your question in the chat. I wonder, unless we've got some immediate questions, to give people a bit of thinking time. I perhaps wanted to take the chair's privilege to pose a question for all three researchers, which is just a question around what would be your advice for local stakeholders wanting to work with or engage with voluntary sector organisations. What would be your advice in terms of how can they get started? Like what's the first thing they should be thinking about or doing? How can they get started in that? Happy for any of the three researchers to come in on that one. I love that we've got your cat participating as well, Alison. There needs to always be at least one animal in the picture.
She's always taking over meetings. It's so embarrassing.
The cat's prerogative. Did you have would any of you like to come in on a reflection for that? So your advice on how can local stakeholders get started in sort of building those relationships with local voluntary sector organisations?
Yeah.
I think the oh yeah, sorry, Alice.
You
Would you
go
like to? Yeah,
You go.
okay, sure. So I think with the local organisations, if they want to get involved with the community, then they need to understand that there has to be longevity in that project. For them to do just one piece of work or part of one piece of work, unfortunately, it doesn't gel with the community anymore. As Hassan rightly said, you know, the communities are tired of being researched on without being part of the research within the design process, all the way to carrying out what sort of the suggestions are from that research. So if there are like serious organizations that want to work, there has to be some level of commitment before that connection with community organizations. Just like how community organizations have a commitment to the communities, to the community members, that yeah, we're gonna try to resolve your issues, or we're gonna try to understand issues a lot more, so that we can then work out some sort of solutions with the contacts that we have. So what we wouldn't want is that as a community-led organization, we wouldn't want any other organizations coming in and saying, not only not about taking over, but it's about defining what the project is without the community involvement, and defining what the solutions are without the community, you know, expressing themselves first. So that's what I would say.
Brilliant, thank you. So involve us early and in the long term. I think that's really clear. Alison, did you want to come in?
Yeah, I mean, yeah, kind of that says a lot. I think, like I said, sort of coming into it with a real willingness, kind of, to be like as open and honest and receptive. Yeah, that can be, you know, sort of, yeah, kind of quite tough, because, you know, sort of, you know, of what people have going on in terms of what kind of what they feel they can offer compared to what in fact might be needed. But yeah, also, you know, it's kind of it's like, I think for me, a lot of the actual chats, etc., they've been quite kind of, yeah, quite sort of what's the word, informal. So like it's been coffee and cake, and you know, not sort of sat round like a big table in like an office and lanyards and a sense of hierarchy. I think if we can all come at it that we're all wanting to help, and so, you know, sort of, you know, kind of, you know, peel back sort of the levels of sort of what seems like power and things like that, because that can be quite confronting, or, you know, sort of seem a little bit jarring. So yeah, I think just, you know, be people rather than I'm, you know, such and such role, I'm this. Yeah. I guess.
Amazing. No, fantastic advice. Yeah. Thank you very much, all of you. So we've got a couple of questions in the